So if you've been told the cue to flatten your back into the floor, well, we're going to show you why this might not be the most efficient way to stabilize the spine, and it goes back to the anatomy. So the lumbar spine has a gentle curve in it that we call lordosis. So when you're lying on your back, we should maintain that gentle curve. Now, if you're trying to push your back or spine down into the floor, you end up actually straightening out that curve, and it can go into a little bit of lumbar flexion, which can be triggering for some people, but it's also not the most optimal position to stabilize that spine. So when you're given the cue to flatten your back against the floor, you end up going to a little bit of a posterior pelvic tilt or a little bit of rounding of the lumbar spine. So what we're looking for is a neutral position. So if Taylor takes her hands and places them underneath there, you should be able to fit your hands underneath the small of your back, and there shouldn't be too much of a gap. So we don't want to be overextending. So if Taylor lifts up and really extends, that's going to be too much of an arch, but we also don't want to be pushing down, because that's going to flexion. So we want that neutral position where she should be able to just put her hands underneath the small of the back, and then we brace correctly, and that's how you keep a nice neutral core.